Let's talk a little bit about panic disorder. I have people come in my office and they say, I'm getting these bizarre periods where I'm short of breath, I get chest pain, my heart is beating really quickly, I get sweaty and crampy, I have these feelings like I'm about to die, or they describe a sense of shortness of breath, like they're choking, they get tingling in their fingers, they feel like they're not real, or they're having a heart attack. And a lot of times these things occur at sleep and wake people from sleep in this terrifying attack. I had one woman, she kept driving to the emergency room and sitting in the emergency room parking lot. I had another man who kept going for, thinking he was having heart attacks, kept going to the doctor and getting a workup for heart attacks. He was sure he was having a heart attack. And the worst part of panic disorder is a lot of people, they're terrified of having panic disorder. They're terrified of the panic attacks. So the biggest component of the illness is they live in fear of these attacks. And so what happens, because they live in fear of these attacks, they're afraid to be in any place where escape may be difficult, which is agoraphobia. So they'll sit by a phone, or they'll sit in the car in the emergency room, or a lot of times I have people afraid to leave their home. They can only be in a place where access to help is immediate, because they're afraid that these attacks are going to kill them. It's interesting what else happens. They start avoiding things. They'll start getting panic attacks while driving over a bridge, or panic attacks at the local grocery store, or panic attacks when they're golfing, or panic attacks when they're around a lot of people in a mall. And then they'll stop going to those places, and the panic attacks keep occurring, so the places they can go are less and less. So what happens is, now you have someone with this fear of the attack, which is probably the most disabling, which winds up people leaving in their home by the phone where they can find safety, and then the attacks themselves. And the attacks sometimes can be hours or days, or sometimes maybe just minutes. Now, one thing good about this disorder is it's usually easily treatable. I can usually, within about 4 to 6 weeks, treat people with Zoloft. Sertraline is a common drug I use. And if people have tried that, I can use Effexor. Drugs like Ativan and Klonopin can also be used to treat panic. It's virtually, I have not had a case in my office where I have not treated panic. What's interesting about this disorder, it does run in families. So I usually have, I treat a lot of young people, so usually they come with their parents, they say, I had, my aunt had it, or my cousin had it. There is a hereditary component. What's interesting though, there's a threshold for the panic attack where it breaks through. So even if you're genetically predisposed to have it, doesn't mean you're going to have a panic attack. And what I tell people, it's usually some event. And when I dig deeper, a new job, a move, a sudden insight that they weren't parented right, issues with their body, they may reach some internal crisis. And so I focus on that. They may be in a job that they can't take, or they don't like how people are treating them, or they suddenly find themselves at a point in their life where it's lost all meaning and they start developing these attacks. Yes, they're genetically predisposed to get the attacks, so the threshold for breakthrough of the attacks is much lower than other people, but exploration of certain issues can also relieve the panic attacks. So a combination of therapy and looking at what's going on in their life that may be causing severe anxiety and panic, and treatment with medication, the panic attacks can be treated very effectively. Thank you.